Good morning, everyone. Well, I got a blank slide. Does that mean I get to say whatever I want now? Good morning. I'm Sarah LeMoine with the PDW Center. That's the easier mouthful of the National Center on Child Care Professional Development Systems and Workforce Initiatives. The PDW Center is jointly funded by the Administration for Children and Families Office of Child Care and the Office of Head Start. We support the ACF goal of promoting a strong workforce, a workforce that's able to promote healthy development and school readiness in our young children with a specific focus on children from low-income families. We work with states and tribes and territories to identify their goals through the vehicle of the Child Care and Development Fund biannual plans. And those plans are submitted to the Office of Child Care every 2 years. So we're funded to provide technical assistance to the Child Care and Development Fund state agencies, the lead agencies, to implement these plans. The center does not interpret the Office of Child Care, the Office of Head Start, or the Administration for Children and Families policies. And the opinions that I am going to share with you here are collected from our TA experiences and grounded in the research compiled by the PDW Center, which operates from 0 to 3, the National Association for the Education of Young Children, Child Trends, and the National Registry Alliance. None of what I'm about to say is endorsed by ACF, nor does it represent an interpretation of federal policy. So with that caveat in place, I'm also going to say to you what I hope is a theme that you'll hear through my non-endorsed comments, that really a theme of a competency basis, as we've heard, a continuum, and when I say continuum, I'm talking about the continuum of children's needs, of programs needs, of teachers' needs, of the workforce needs, and also of systems. The PDW Center, again, is really focused on the systems aspect. So I'm going to go right to the questions we were asked. First and foremost, what is professional development? The framing of how we define it. At the PDW Center, we refer to professional development as training, formal education, technical assistance, or TA, and practical experiences. And in our definition, we include both professional preparation, what you must know and be able to do prior to employment or pre-service, and ongoing development, what you must know and be able to do to stay in your role, the in-service piece that contributes also to progression. This is a blurred line in our field, and I'll talk a little bit more about this. But really the purpose of, as we define it, of early childhood professional development is to prepare and to continuously support our workforce, including myself, all roles, to provide opportunities to improve our knowledge, skills, and our practice in our work with young children and their families. Again, my work and my colleagues' work really focuses on professional development systems. And in particular, we focus on aligned professional development systems. And what do I mean by that? Well, when I say aligned PD systems, we're talking about systems that consist of the related efforts and services and supports that address the continuum of workforce needs, that have a common goal of building and sustaining an effective workforce that includes education, training, and TA again. Exactly which sectors and systems compose a state and territory's vision for an aligned system really depends on its context. That includes its political and fiscal situations, where and how the PD system fits in the larger early childhood and school-age system, and its specific goals and priorities. A state and territory's context, therefore, can best dictate what they really mean by successful alignment efforts. But overall, there are some general principles, and we believe that PD systems should be an integral part of a state or territory's larger quality improvement efforts, that they cross at least the primary, early childhood, and school-age sectors, that they have a clear governance structure, that they be evidence-based, carefully planned, guided, monitored, evaluated, and revised as needed. Using a comprehensive workforce data system that links or is part of the state or territory's overarching and related data systems is also of great import. Having varied and sustainable financial resources, which is definitely benefited by working across sectors, is also essential. Being based on consistent professional standards including core knowledge and competencies, is a foundation of an aligned system. Having the capacity to provide standards-based training supports courses, degrees, and portable credentials based on those standards is also essential. Letting professionals know about and ensuring their access to PD is another principle. Having those clear pathways that let them know for and plan for career opportunities, and including quality assurance that meets the diverse needs and abilities of the workforce. And last but certainly not least, linking increased qualifications with increased compensation and benefits. So basically what I just said in those principles is that a truly aligned and comprehensive system lets people know what's available, provides them with quality PD, gives them a pathway and a trajectory for receiving that PD and what's available to them, and it compensates them for it. Here's a graphic, and I realize I didn't look at the clock and this is not working, so I don't know how far along I am. Great, okay, thank you. I just took up 30 seconds to say that. As policymakers and other leaders work to build aligned systems, there really are a whole host of different stakeholders to consider. And I just talked about how states and territories and their PD systems really make that determination. But in our work, we're talking about both direct and non-direct service that crosses roles, that crosses settings, that crosses the sectors at least of child care, Head Start, early Head Start, public pre-K, primary, early intervention, and also related systems underneath there, which isn't in the circle, so just use your imagination. And when I say related systems, in some states, they consider them essential systems. So, for example, we just heard about the home visiting pieces, so the health, mental health, et cetera. There's really been significant investments in these PD systems to sustain and also to prepare a well-prepared workforce. And the single integrated system that provides these opportunities of growth from entry level through advanced levels of education, training, and TA also contributes to staff retention. Basically, the point is that all of these sectors of the early care and education workforce require well thought through quality PD opportunities that result in early educators, early professionals who are not only prepared to support children, but are able to achieve for themselves their optimal development as well. A lot of times when we do skip right to that outcome of, so how does it change for children, I do agree and was heartened to hear the reference to implementation science. That underpins all of the work that we do at the PDW Center, Implementation Science. So to the questions of what skills and competencies are you supporting or approving that we were asked as a panel, what have been or will be the measures or benchmarks of your success, I'm going to share a little bit here about our mission and goals at the PD Center. They're huge here as you look at them, really to build state and territory capacity to produce professionals across the age ranges, settings, sectors that we just talked about, and to support them in changing their behaviors, improving their practice in programs for children and families or on behalf of them. The PDW Center creates specialized TA tools to support professional development system assessment and strategic decision making. Again, that is undergirded by implementation science. We facilitate topical cohorts for system leaders. We coordinate the work of infant, toddler, and school-age communities of practice. We support the Administration for Children and Families' efforts to explore and address system capacity to increase access to portable, individual professional credentials. Here are our main three levels of technical assistance we provide and the four focus areas. At this point in time, the PDW Center staff is providing technical assistance to all 56 states and territories. We are really, in all of this, focused on a competent, committed workforce that's trained and skilled so that interactions are intentional. And they result in child, family, program, workforce progress. So we provide TA at three levels: at a basic level to raise awareness and share information, at a targeted level to build knowledge and skills, and at an intensive level to promote leadership and support implementation. These are the 4 areas, some of which I talked about already, but very quickly because my time's ticking down. Strengthening the workforce and resource targeting is really about supporting state and territory assessment of their investments. And why? Because aligning investments with priorities increases effectiveness and optimizes the intended outcomes. We're providing intensive TA on this to all 6 states in the ACF Region 5. Credentials and reciprocity, I talked about a tiny bit there. And really, we're looking at ways to explore and advance credentials and other PD across state and territory lines, as well as within a state or territory across sectors. Regionally and nationally recognized credentials and reciprocity can really increase PD capacity and access. It supports career progression, and it results in resource savings. So that's a lot of the hook that goes in there to the work to do it. It makes sense for our workforce, but it also reduces duplication of efforts. We have a great cohort on this in Region 3, ACF region, that has looked at technical assistance providers and the standards that are available to them in the PD, and they are moving mountains with what they're able to share with each other and accept across those states. Workforce data systems, data-driven decision-making, connecting to the longitudinal data systems. If we don't have comprehensive and accessible data to support our workforce and link to other quality improvement efforts, we're not really able to say the changes that are taking place, the benchmarks we start and need to make. Without it, we can't really provide the evidence to continue the work and do it in the best way possible. One of the big notes here in our work on workforce data systems is that a lot of states have not had the opportunity to really shore up the systems they have in place, and they're already expected to be contributing to longitudinal data systems when they don't really have a good handle on what workforce is existing in their states already. Oh my, I need to hurry up. We have a lot of indicators. I hope you asked me that as a follow-up question. Here's our 3 key focus areas. At the bottom is a link. I got a 0, but I'm going to say it anyway so you can get the hook out, which I said you wouldn't need for me. But at the bottom here is a link to looking at access to PD, compensation, and workplace conditions. Until we address those 3 key issues, whatever professional development is not going to be lasting and have the impression. My 5-year-old's elevator speech is that my mommy and her friends help people, help teachers be excellent, so kids like me can be happy where we learn together. Thank you.